Hello again. Today I'm going to talk to you about teeth, the different types of teeth, the different jobs that our teeth do and why we need them really and why we should look after them. When we're a baby, we start getting our baby teeth or milk teeth or deciduous teeth. So this is going to be our very first lot of teeth. By the time your baby is 2.5, they should have all of their baby teeth. So at the very front, they will have incisors. So those are the very front teeth and the ones next to those. Those are central incisors and lateral incisors, but they are incisors, they are cutting teeth. So that's why they have the edge that they do, making the food small enough for us to chew. The next tooth along is the canine tooth, which is often called the eye tooth. This is quite a pointy tooth, not so much in baby teeth, it's not as obvious that it's a pointy tooth, but that is a canine. Now the difference between children's teeth and adult teeth is children's teeth don't have premolars. We jump straight to molars. So they will have 2 molars in each quadrant or quarter of their mouths. Behind the baby molars, the first permanent molar will start to come through at about 6 years old. Now, it's really important that you keep an eye on the eruption of these teeth, because these are teeth that are going to have to last a lifetime. So make sure that they are well brushed. And look after them. In some children, if they've had a history of decay in their baby teeth, dentists might suggest putting a plastic coating in these first adult molars, which is called a fissure sealant. It just fills in all the fissures and grooves in the teeth that food can stick in. So when we get to about 6, 7, depending again on how dentally advanced your child is, the earlier they get their baby teeth, the earlier they will start losing their baby teeth and the adult teeth will start coming through earlier. So again, we're going through a sequence of the teeth coming through. So we have 4 incisors on the top and 4 incisors on the bottom. Then we will have the canine teeth, just like in the baby teeth. In adult teeth, you notice it more because they are quite large teeth. They have long roots, they're quite bulky, quite wide, and they're almost the cornerstone of the mouth, so it sort of shapes your mouth to a degree. Behind them, differently to the baby teeth, we have premolars. So they're like molars but a bit smaller. So we have 2 of those in each quadrant of our mouths. They are chewing teeth, so they've got a biting surface on them. Behind those, we have our molars. So we've got the molar that came through when we were about 6, and then probably 9, 10, 11 even, you will get another lot of molars all the way around. So then the only teeth that are missing then are the wisdom teeth, which for most people, if they're going to erupt, they will erupt between the ages of 18 and 25 normally. Now, wisdom teeth do have a bit of worry people, they think they're going to have them out. It's not always necessary. If there is room for the wisdom teeth to come through, then we would just let them come through. If there is a problem with them, if they're impacted, or the gum around it gets regularly infected, or they're in such a position that it's really difficult to clean them and they're starting to decay, that would be the point that the dentist recommended extracting them. But otherwise, these days, we leave them in situ. It's not a problem. I mean, in fact, there are a lot of people these days that are evolving and they don't have wisdom teeth at all. But as I say, if you've got them and they're causing you no problems, no reason to take them out.